Okay,
All
we're
right.
going.
So let's go over stretching. We start from the bottom and end at the top. So the first muscle would be the short soleus muscle. Principally, you cannot stretch a muscle that is under weight-bearing condition. So you often see people stretching like this, or stretching like this, or whatever, but this is not stretching, because as long as you give the muscle another work to do than being relaxed and getting longer and longer and longer, means deep stretching. As long as you give him another information like hold me, otherwise it will fall off or fall down, then you will never get this relaxation that is necessary to get a good stretch. So all stretching with the intention of getting a longer muscle at the end needs to be done without any weight bearing or any conqueror information to the muscle in the same time. So go down to the floor, and like as if you want to stretch the soleus muscle, the knee can be or should be flexed, and if you move your right leg, the right knee more forward, you get a closer angle to your joint. Or should I show it to that side? Okay. So now we change to this right side muscle. Okay. So your weight bearing is basically on your left side. This is the part that gets stretched, and if you put your left knee even more in front, then you get a smaller angle from the foot to the tibia, and so a greater stretch. And let's say it once for all strategies or all stretching procedures. Stretching takes time and not much power. So you do it for a long time, means 5, 6, 7, 8 minutes for one muscle. So you start going forward until you get a bit of a stretch feeling, and when you're too far and your heel is leaving the ground, it's over. So don't do so. So keep it here, and after a while you feel a stretch. When you feel the stretch, you do a deep inhale, do a deep exhale, and try by exhaling to relax that part there where you feel the stretch before. And if the stretch feeling is reduced after exhaling, then just go a little bit forward with your left knee to increase or reduce the angle, to increase the stretching position, and then you wait for about 20 to 30 seconds. After that time, you inhale again, you exhale again, try to relax. It takes some seconds, 3, 4, 5 seconds. After that time you might feel a reduced stretch, and then you can go further. If you do not feel a reduction of a stretch, stay in this position and wait another half minute, and then you do it again. So a procedure where you want to stretch a muscle, and the muscle is built up by two main tissues, fibers. It's like collagen fibers and muscle. The muscle is the part you cannot stretch. The fibers, so the collagen, that holds the shape of the muscle. That's the part that contracts, and that's the part you want to stretch. So, and the muscle in the muscle holds the muscle away from getting longer, as long as you give him other informations like standing on it or controlling or whatever. So you need to get this muscle in the muscle tissue in the muscle relaxed. That takes time. And if you force it too much, then the muscle fights, and then you will never get this relaxation. You need to get to that point where you stretch the fibers in the muscle, but that's the goal of the whole procedure. Otherwise you will do stretching your whole life, and you will never get any process into into longer, getting longer. You will always stay on the same level at the best part. So after another half minute, you go even a deep inhale, exhale, try to relax. You can read a book or whatever, yeah. And if it reduce the tension a little bit, then you go half a centimeters forward with your left knee to reduce the angle again, and then you stay. And after when you want to finish, so after 6, 7, 8 minutes, then you slowly reduce your stretch, reduce the position, get out of it, and do some loosen up. Okay, and then you can change to the next side. So,
question.
Okay.
Actually, one thing. Can you step back just a little bit?
Sure.
Because the lens is not very wide angle. Perfect.
So you want to put all on one video, or this just for the soleils?
No, just make one video.
One video, okay.
I can edit it.
So next
but
one.
let me question.
Yeah.
What is the benefit of this deep stretching? Why is it worth the time? What's the big what sort of benefit will you see?
If you want to increase the range of motion of your angle of your joint, then it is necessary to stretch those tissues that hold it back from getting into all these positions. So if you want to surf,
yeah.
And if you cannot sit down like this or like this, okay. So if you hardly can sit like this, and if you want to go down, then you fall off. Okay.
Yeah.
That means that your ankle has not enough range of motion, and as long as it is muscle that holds it back from getting into the right position, then you can use stretching techniques to increase that. If it's not your muscle, if it's like in this ankle, the dorsal part of your capsule, you cannot increase it with these muscle stretching techniques, because the muscle stretching techniques are no capsule stretching techniques. Therefore, you need manual therapy. You need a therapist who does it for you. Okay, to find out it's not possible by your own. You need a therapist for that. Okay, but basically. You can try, and if you notice after a while, after a couple of weeks or month, you do it right, but there's no benefit, so it's not a better position that is possible getting there. Then, and if you want to get a better position, then you need the work of a therapist.
Okay.
Because he has to work on the capsule that you cannot do on your own.
Okay. And what is the first position that you were what were you stretching, or what was?
It depends.
Well, the one you just showed.
Over the main.
The general theory.
Yeah, it's like general.
Okay.
Basically, you concentrate on those where you have the most deficiency.
Okay.
That's the one you invest most of your time.
Okay.
So do not work on those you're good in.
Right.
You need to work on those you are bad in. So
okay.
That's all about. Okay.
That makes sense.
So this is for the short muscle, short soleus, short calf muscle. The next one, you need something like this.
We have the physio ball too, if you want to use that.
That's okay. Just to give you an information how it works. Okay. So you need something to sit on. You need something to put your foot on.
Okay.
Okay. And then you try to give your heel as close to the wall or to something you put your foot on as possible, and then you simply go into the stretch, like giving a little bit of compression to your knee in intention to straighten it. Okay.
Is this for a hamstring?
No, this is for the long calf muscle.
For the long calf muscle.
Yeah,
okay.
It's for the long calf muscle.
Okay.
So for this position, you have two options to increase the stretch. First option, you sit higher.
Okay.
Okay, like here, you see,
yeah.
you get a closer angle. or you put something at the
Sure.
at your close to your toes, okay, to increase this angle.
Okay.
And then the same strategy, okay?
Okay.
You start, you hold it, you wait half a minute, you feel a gentle stretch, and then you deep inhale, you exhale, and you concentrate on this area in your muscle where you get this stretch feeling. Try to relax there, and if you can relax, you go a little bit more into the straightened position of your knee. And if the knee is straightened totally, you need to go to the next step. As I said, sit higher, or put something here, or try to put your heel even under this this desk here, okay?
Okay.
And then you start again.
Okay.
Putting it down, okay? Same thing.
Okay.
Going to hamstring, which is the next following muscle group. We need something different.
What are you looking for?
Actually, we need something like this. Can I open this, or do
You
we
can
have
open this.
mosquitoes all night then?
No, it's okay.
Okay, I'll make it like this. Okay. So for the hamstring, it is very important to know that with the hamstring connection, your pelvis is connected because the hamstring is attached to the pelvis.
Okay.
And if the hamstring is very short,
Yeah.
your pelvis goes right away into this direction, into this nutation.
Okay.
And with this nutation, you right away directly get the stretch into your lumbar spine stabilization system. So the lumbar spine ligaments that are attached from one spine to the next, which is a big problem, because if you do not carefully care about this connection, then you can draw into the hamstring by stretching. You can get an instability, so loosen up of your stabilization system in your back. So it is important, if you do so, you have something underneath your lumbar spine, like, let's look here. May I take this?
Sure.
Hello Kitty.
We have a
So?
bigger pillow here if you like.
No, that's fine. That's fine. So you simply put it underneath your lumbar spine to keep a little bit of lordosis, okay?
Okay.
Like in here. Okay. The opposite leg stays down and this side goes up.
Okay.
Okay?
I see.
So, and it's just...
So this corner over here would be good, over against like a corner. Same thing.
Yeah,
You could
same
put
thing.
like-
Doesn't matter. Usually we use the doors,
The door.
the parts of the doors, right?
Right. You don't want to put too much pressure on the glass door.
Right. So, yeah. And it's the same thing.
Yeah.
You start in a position where you comfortably
Yeah.
get into. Okay. You can also lift up your toes a little bit.
Yeah.
Makes it even a combination to the calf muscle.
Yeah.
But it's hard to really relax if you do any muscle activity.
Okay.
So just leave it, because it's this one we had before. Okay.
What about using a strap? You see, people sometimes use straps to do
Yeah,
this.
they can do, but as I said, the major goal for all the strategies of stretching is a relaxation, to get a relaxation in the muscle as good as even possible. So
Okay.
any other activities, even with your hands, holds you back from really relax.
Okay.
Okay, so concentrate on do nothing else than relax of this muscle, and as easier it is, as better it is.
Okay.
Okay, so you start with this in a comfortable position, and again after 30 seconds, something about that, you deep inhale, exhale, relax this area where you feel the first stretch, and then you go a little bit further, okay? And if you are fully extend in your knee, then simply move a little bit closer into the door and do the same thing, okay? Start in a not completely strength position, and then you wait 30 seconds, inhale, exhale, go a little bit further. When you get a relaxation, if not, stay in the position. You need to wait. Don't fight with the muscle. If you start fighting, you lose.
And how many days a week do you recommend?
It depends how tight you are.
Okay.
It definitely is a question, very individually. And as more years you did not do it right, and as more tissue fibers you got contract already, as longer it will take.
And what about, say, like the time of day? Like if your muscles are you've already exercised, so your muscles are naturally looser, versus say earlier in the day. Any recommendations for what you found to be most successful for people?
Most people they benefit by warm muscle. So if you warm them up a little bit, okay. It is not a good idea to do because with this stretching you destroy the tension.
Right.
So it's controlled by nerve roots, okay? The tension, the activity in the muscle. So after this deep stretching, the muscle is not that good in action.
Okay.
So if there are studies around, if you run 100 meters after this kind of stretching, you are by far slower.
Sure.
Definitely, because that's why the athletes they do the opposite thing before they run.
Right.
They do everything to activate the muscle to keep the main tension higher.
Sure.
To get it in a higher position with adrenaline and so on and so on. And this is the opposite thing. And it's also it's not only stretching. It is exercise, because exercise means you give your muscle system a job where this muscle is not good enough for. That means exercise. But this job is the opposite side of a normal exercise. Normally, exercise means contraction.
Right.
This means relaxation, and therefore it needs time. If you go surfing twice a day, you will do a strong exercise. You know you need to recover before you do the next exercise, and it's the same in here. So it needs time that the muscle needs to work out this job of exercise, to do all the changes of the fibers, rebuilding stuff, and so on. Okay?
So it seems like evening would be a good time.
Well, as I said, to my athletes, I always recommend a day off. So days where they do not have this muscle under hard exercise.
Yeah.
So this muscle, for example, for swimming, it's no problem.
Right.
But for hard bicycle runs, it's a problem.
Sure.
So they should not do it on the same day, because
Not even after.
Not even after. This is not good before. It's not good after, because you give the opposite information in a too short time, and the muscle does not know exactly what to do. Shall it relax or shall it strengthen? So and these two jobs they do not fit to each other. So give it one job exercise or one job relaxation like stretching, but not at the same time. So do it separately. And if you go surfing, well, you do not need these muscle groups. You need the arms.
Sure.
So on these days, go on the lower parts. And on days where you do not surf or just relax surfing a little bit, then you can do the stretching of your upper body, for example. Okay. So that's hamstring. Okay. Go to the next muscle group. As I've shown you, yes, you've seen in the other video already. I need that. There are some options.
Slide back just a little bit.
Sorry.
I can't go any. Yeah, perfect.
There you go.
Perfect.
So there are two main gluteal muscle groups. Okay, so you can start with the external rotation of the right hip, and then you bring with this side. You bring it simply closer to you, and if this is too exhausting, because when it's very tight, it is very exhausting, especially if you want to control this position like here. You can give yourself a help, like put in here, okay?
Okay.
Or you can even use, again, the door, like, actually I like that more.
Or any wall. Yeah.
Any wall. Any wall like this. Okay.
Okay,
And
so that way you can have the legs straight.
Has the opportunity, the advantage that you, the other side, again, with your back, okay? I actually would need the pillow again. But if you can keep this side down, the pelvis has to stay. It's not possible to get this flip, okay? If you lift it up, then you get the stretch into your lumbar spine, which is not nice, okay? So keep it down, and it depends on what kind of group you want to go to. If you move a little bit more away from the side, you get another stretch than if you move in here.
Okay.
And you simply go into through the door again to get a deeper stretch, and so you can nicely control.
Okay.
Okay. And with here you simply increase the stretch if you want to after the 30 seconds. Inhale, exhale, relax, and when you feel the relaxation, you can go a tiny bit further. Actually, after relaxation, the tension should go down, and after moving a little bit forward, it should go to the same position as it was. So generally stay at the same level of stretch, not pain. It is sometimes not a nice stretch feeling, but it should not be any pain. So as ever you get the impression the muscle cannot relax, it starts fighting, you're too far. Go back. You don't have to stop. Just go a little back and try it again. Okay?
Okay.
So for the gluteal muscle area, there is a position, you can do it.
Is it a good idea before starting some stretching to maybe ride, say, an exercise bike for 5 minutes or a treadmill
10 minutes,
just any sort of
up.
some
Perfect,
sort of warm up will definitely help.
Very good. Yeah, definitely. It's much better than starting cold. It will get warm after a while. If you do it, it takes longer.
What's more efficient, if you spent longer, the same amount of time, if you spent part of it with the bicycle or a little 10-minute warm up, versus if you just held the position longer?
I think if you have a lot of time and you want to do a lot of different muscles, warm yourself up on a bicycle.
Yeah.
If you only have 15 minutes and you want to go on one specific muscle group, just stay there. Just do it there. Because the bicycle warms up everything, let's say like this, okay? So it works on all other muscles too, so it's more efficient if you have many muscles, do it on the bicycle, warm you up, and if you only have one or two different muscles, then do it just by a longer stretching and a gently start of stretch. Okay.
How about a treadmill versus bicycle? Any preference?
Treadmill, well, the best thing would be this, I don't know the word for that.
Nordic track.
Yeah, Nordic track.
We don't have one of those.
Yeah, because there you have the arms included, okay. But generally you have more muscle groups included on the bike than by the run.
Okay.
Okay, so the abdominal muscles are much more involved on the bike, on the bicycle, and the arms too a little bit. So bicycle is a bit better than running. All right. So one alternative to the gluteal position I've shown you using the door. It's the one where you have a 90-degree angle in your knee, and then you try to position your pelvis into the direction of the knee, and this goes to a muscle area in the gluteal area of the medial gluteus muscle. You have three. You have the maximus, you have the medius, and the minimus. So three different, and they are spread out like in an angle of I don't know, what, 70, 120, 130 degrees, whatever. So if you want to stretch them, you can do it a bit more separately. First position, you move your pelvis facing this line, facing your knee, and then you move a little bit into the position directed to your knee. So please do not, if you walk around a little bit, just walk around.
Okay.
And so I can show you what is very important. So the goal is not going down with your upper body,
Okay.
because then you stretch your ligaments. Okay. The goal is to bring the cause and the attachment of the muscle into a longer position, and that is done by simply moving your pelvis a little bit more forward, from here to there. It's a tiny movement, but it's definitely enough to get a stretch into the gluteal area. Okay?
Okay.
So this is for the medius. Then you have the one for the maximus, and therefore you need to twist, to turn your pelvis a little bit. So do not stay here and move there, because then you get a stretch into your lumbar area again. So position yourself different, and then you move your pelvis into the middle part of your tibia, like into here. You see that? From here to there.
Okay.
And if you put half of the tibia into the into the other direction, okay, like your tibia would go here, okay, half of that, like here, then you have to turn around your pelvis into this position, half, knee, half, okay?
Okay.
And then you move your pelvis into this.
So this is the third part.
This is the third. So
first the
1,
center.
2, and then up to here, 3. And this is for the minimus, which is usually hard, pretty tough to stretch.
Okay.
And to secure your lumbar spine here, because you have no pillow now, okay?
Sure.
It is necessary to get the other side pretty much straighten. As more straightened the left side is, leg is, as more secure your lumbar spine will be.
Okay.
And then you need to get your weight away from the muscle by holding it with your hands. Otherwise, you have too much pressure, too much draw on the muscle, and you will not get a relaxation in the muscle. So make it easy, especially at the beginning. Don't go into the maximum stretch. Oh, now you have a lot of stretch, that's good. No, it's not good. It doesn't work. Okay? So start with a gentle stretch in this position, and then work yourself forward a little bit. Inhale, exhale, and just if you notice that after exhaling you get a relaxation of the muscle, so a reduction of stretch feeling, then go a little bit further. And it's almost hard to see, but you will feel it. You know? Okay. Very tiny movements, and you feel it right away. Okay? So that's for the gluteal area. Next one is the psoas muscle. That's the one that lifts up, okay, like here. If you tight by sitting all day, okay, in this position, getting tight.
Okay.
But if you want to run, and for running it's important to open this angle, otherwise you end up running like this, okay, but that's not good. Running means you open it, and for this opening you need a relaxed psoas.
Okay.
And that's the one that, by surfing for example, that gives you the position or the option from here to do in a quick way, stable way.
Yeah.
If this does not work properly, you have problems. Okay.
Okay.
So to stretch again, you can go to that side. Give it as much support as possible, that you have less conquer jobs for this muscle than relaxation. You can do it like this. Okay, so this is this stretch here. You have most of your weight bearing on both sides of your arms, on the left foot, okay? And if you start, for example, in this position, you have a small amount of getting more stretch simply by tilting your pelvis a little bit into this direction, okay? So from here to there you feel more stretch. If you are almost down, you go further away with your knee. So that will be the next gear, okay? For the stretch.
Yeah, could you go over that one more time? That's very subtle.
What do you mean subtle?
It's just, I'm looking at it, it's not...
Okay, once again. So, you start in a position wherever you feel the first stretch.
Right. Now why on your fists as opposed to on your palms?
A lot of people have problems like doing this.
Okay.
They get a compression here.
Okay.
They get a pumping of the capsule, building up ganglions.
Okay.
Ganglions. So filled up with fluid bubbles out of the capsule.
Okay.
So get problems.
Okay.
So this is a high. It's quite a bit of a stress.
Okay.
So this most people can do. Okay.
So you extend out your back leg.
So my back, as usually,
Straight.
is fully secured.
Okay.
So please do not do it like this. Okay. So this is not nice. There's a lot of compression here. It's not necessary, and there's a high amount of control. If you compare that, this leg has to control that I do not fall off, fall. Okay.
Okay.
So this is the stable position.
Okay.
And there you can relax. You can relax. If you have problems by getting that far, by having not this angle, having compression in your knees or pain in your knee by this, you can use anything like a chair or a bed or whatever and hold yourself like this.
Okay.
It's possible too. So there are many options. Simply get as much pressure, drawing forces of the muscle that you slightly can control and increase the amount of more stretch.
Okay. And where do you feel the stretch?
The feel of the stretch is right here, in the groin area.
Okay.
There you feel the stretch.
Okay.
So, and by tilting your pelvis from here to there, you get a bit more stretch.
Okay.
And if you cannot tilt any further, you need to go away with this knee, or you can go a little bit further with that foot. It's the same thing. Okay. To get a greater distance of the knee and the foot. And then you get into the next stretch. Okay. And then you start in the horizontal position of your pelvis again, and then you can increase after 30 seconds. Inhale, exhale, relax. When you feel the relaxation, you go a little bit further. Hold it another 30 seconds. Make it as comfortable as possible for you. And then you go into the next position. Okay?
Okay.
And it is important to accept that when you do it right, you get a stretch, but you get the muscle into a position where it is not that secure of getting hurt. So if you stretch the muscle and then you let this muscle you already have stretched, you do activate him, like I say, for example, I use this muscle for getting me up again. Then you risk that you destroy some fibers because they're not gently attached to each other. Okay, so make yourself sure that if you open up your stretching position, do it without using the muscle you just have stretched. Okay, in this case, for example, I would lie on this one, open it up like here, and then helping myself into getting into this position.
Okay.
Instead of being into this position and then drawing with my psoas muscle my leg into up here.
Right.
Okay, that would be the opposite side, which would be not that
Counterproductive.
Yes, right. So then we do have the adductors. They are even more how do you say, gently to stretch than all other muscles, because they do not forgive mistakes that much than other muscles. So be even more gentle with this muscle group here at the adductors. To stretch them, it's pretty easy. Lots of you you probably have seen this kind of stretching, okay? But this is easy from here to going away a little bit and secure your body weight with this arm, which is very important. So don't have your whole body weight on this muscle group, okay? Because then it gets more and more stabilization jobs in the same time.
And that's where you feel the stretches right there underneath?
You feel it.
Okay.
Definitely a strong tension,
Okay.
but you will never get a relaxed muscle, so you
Okay.
will never get a stretch of the fibers. So secure it, and then you can that's reduced stretch feeling, which is good, and then you simply go even further. So as more far away you go, as greater the stretch will be.
Okay.
Okay, which depends on your pelvis position. Okay, because the pelvis here is like in the angle upgoing. Okay, and if you go further away with your foot, your pelvis is going more and more down. Okay.
Okay.
So this gives a greater stretch. You can combine that with another one, like this. You probably know.
Sure.
Yeah. So some of these techniques you probably have seen before, but you want to know what to do and you want to know what not to do, because you have seen this kind of stretches like this also.
Yeah.
And now you know why this does not work.
Because your weight
Now
there.
you know why this does not work.
Right.
You know why this does not work, why this does not work. So you can easily mark
Sure.
your book examples on your own. This does not work, this does not work, this is not good, that's not good,
Yeah.
this is good, this is good, this is acceptable.
The one you were just doing on the floor, that's one where my knee will pop.
Which one?
The knee that's hyper.
By this?
No, the next one you did. With your leg straight forward. With your knee tucked in.
Like this?
Yeah. Like
Yeah.
right there, the right knee.
Yeah. Be careful, do not put it in like this.
Yep.
Okay? So this gives a combination of flexion and a little bit of rotation,
Yeah.
because the foot is going this way,
Yeah.
your hip is going that way,
Yeah.
so you get these rotations. So this is going internally, this is going externally, and this makes a lot of stress to the medial meniscus.
And then I
So-
hear my knee pop.
Yeah, so you can do it like
just
in,
put
in
the-
this position.
Put the heel near the knee.
Yeah, like in this, you
Okay.
can do it. You can do it.
Yep, that's no
Like-
problem.
This is a problem.
No problem.
This is no problem. So you can do it like this. Okay. But if you have problems like in the medial meniscus, I wouldn't go that close. Okay.
I could not go that close.
Yeah. So don't do it.
But
Choose the other way. Take this one, and you have no problems.
it's the same stretch.
It's
the same-
almost the same stretch.
Because I thought the
Almost
stretch.
the same stretch. And if it's
I thought the
if it's
one
giving
that.
too much stress here
Yep.
and less stretch there, then change it. Do it like this. Okay, with a relaxed knee.
Okay.
Just do it like this.
The one you were just doing, I thought that one was for the hamstring, but it's not.
No, the hamstring is relaxed. Even here, the hamstring is
No,
not
but it's not. It's not
focused.
stretched.
No, here the hamstring would be in stretch. Okay, but it's tough to control your weight.
Yeah, that one's would be very tough for me on the knee.
On that
That's
side, yeah,
yeah.
because that's why I didn't show you.
Right.
Okay, so there are a lot of different positions that might work. Okay, but it is hard to find a position where you do not do any harm to other joints and where you can nicely control your back from
Yeah.
getting too much stress and so on. So these positions, they do work.
Okay.
So the back does not need to get stretched. There's no need for. I know a lot of people tell a different thing, but it is not a question of your back to rotate, to move. It is a question of your hip. So you need to work on your hip to get more rotation. So you see a lot of people doing like this, you know, or like this.
Yeah.
We all did it before we go in the swimming pool like this.
Yeah.
Okay, but the main thing that has to rotate is both those ball joints of your hip, that the whole pelvis can rotate on those two ball joints. Okay, but the pelvis, including the lumbar spine, that's a chain. It has not the job to rotate. It's a question of the rotation ability of the hip. So increase the rotation ability of the hip, and you have more freedom in everything we do. You do on the surfboard, you do playing hockey, you do whatever. It's not a question how good you are in your back spine. And the back spine, by rotation, is the most critical force to destroy the spine, the disc, and whatever. Okay?
Okay.
So,
How about the shoulders?
yeah, let's
go.
come to the shoulder. We do need like this.
Sure. Do you want me to help you move this over?
No, that's fine. That's
We
fine.
can move this over.
All right.
Okay.
So, well, shoulder. You have most people, because sitting.
Yeah,
here,
yeah.
Okay. They have a contract pectoralis muscle, especially the minor muscle that brings the shoulder in front. Okay, which is not good, because then your shoulder blade cannot rotate properly. So with protrusion, we call that protraction of the shoulder, you cannot lift up your arms. You can only lift up your arms when your shoulder are up, and then the shoulder blades, they can rotate, okay,
Yeah.
and then you can go any further. So if you contract like this, you can always easily get an impingement, compression of your shoulder, just because the shoulder blade cannot rotate, so the shoulder roof cannot flip up, and then you cannot reach the full amount of extent of range of motion. Okay, so this is an important thing to do, and to do so you can start in a horizontal position. With the same side you move forward of your leg, okay? With the same side of your leg you move forward, and by going forward and going down a little bit, because when your knee goes forward, your body goes a little bit down, you get into a better stretch, okay? So don't do this and don't do that, because then you get no stretch. So go with the same side, start in a horizontal position, and then you go simply a little bit forward.
So keep your chest perpendicular to the wall where your hand is.
Yeah, right. You can start in this position, and if you're getting better, you can move up a little bit until about a 30-degree angle from horizontal. So in total, it's 120 degrees. Okay, and then you start again, going a little bit further down.
And this is for the pectorals?
Pectorals, basically minor, but also the one part of the major.
Okay.
Too. Okay. So, which is a very important thing. The next one is triceps. Triceps. I need to show you this side actually. Triceps. Important to know about the triceps, because its attachment up there, it is necessary to go in a direct way into going to the back. So you will see a lot of people pulling this way.
Yep.
This is not good because it unstabilizes your shoulder capsule.
Okay.
So it's a good way to get a loose shoulder, unstable shoulder, but it's not good for a stretch. So keep your hand like this swim part here on your shoulder, just put it like in here, and then bring the elbow straight up and help yourself. You can do it on the wall, okay, and then you simply need to go more down to get a greater stretch. Okay.
Okay.
If you are good in that and you already have reached a good position, you can do it free just by bring your head a little bit more straight up. Okay? You see that from here to there? Yeah? From here to there?
Yep.
But if you're that tight that you have to start here, you can.
Yeah.
You will not reach the position. Then you need to start with something
the wall.
that helps you, like a wall. Okay? And then you start in here. Okay?
Okay.
Same thing for the lat, which is it's the most important swimming muscle. Okay, latissimus. You can do it like in here. You can do it on the floor, like this position up here. Okay, and when you get a little bit more forward with your arms and fingers, then you get a greater stretch. You can do it single side, like holding it with the other arm and going into a little bit of a barrel, okay?
Okay.
Like in here.
And you feel that on
And
your
you
right
feel
lat?
the stretch right down into your lumbar area, because that is where the muscle is attached, okay? So, like this.
Okay.
And it's easy to find the next step for the next strength, okay, for the next position. It's easy to find out there. It's not a big deal.
What do you think of using the TRX straps for some of these stretches?
What straps?
The straps that are attached to something on
You can use as long as you do not have to hold something.
Yeah.
Because when you grab something with your arm, all the muscles get tightened, and this is going even higher. So even holding something here and grab on it, it's not that good. Then I would do it like this, okay? Secure it here and going like this. Instead of grabbing something, holding something with the same arm. It's not because the muscle control does not stop at the elbow, even if the muscles stop here, it goes right away. And then you get not that relaxation. Another very important muscle is the one that is on your shoulder blade. That's the muscle that externally rotates the shoulder, the infraspinalis.
Yeah.
Very important muscle, makes a lot of trigger points, so muscle-related pain points that can go produce or present pain or tingling feelings into the whole arm. So it's good to stretch this one, and this is done in a position where you, I don't want to stretch the right side, so this muscle on here, I want to stretch, so I bring the whole arm into a crossing position. Then I use the opposite side in the position of my elbow, here. The thumb of the right arm shows already into the direction of the stretch, of the movement of the stretch. And then simply bring your shoulder down, the right one, okay? So don't stretch it like this, doesn't work. Only compress here, painful over here. So use your left hand to bring your shoulder, bringing the shoulder down by, you do not really press, actually you lift up on the left hand side, okay? So do it like this, and then you can stretch. So it's a balancing position from the starting position. Then you lift up your left shoulder a little bit, and this brings the right shoulder down, and then you do a stretch into the direction of your left thumb, like in here. And then you feel the nice stretch all over here, this area. Okay? You got that?
Okay.
If this is too tight or too exhausting, and you already get the feeling you cannot really relax because you have to fight on the other side too much, okay, which is not nice, then you can try it on the floor. Like doing pretty much the same. Bring your thumb up, okay, and then you run a little bit over it, and try if you get a stretch there. I do not really feel a stretch, but for people who are very tight, they start getting a stretch over, like here, okay. So, and for them, the other position I've showed you, like this, they start like here. And they have problems to get with this elbow into that starting position. Okay. Yeah. For them, the other technique is better, definitely. Okay. You could do it at the wall too, right? So like here, hold it and move. Okay. It's also possible. You simply need to make sure that the shoulder is not getting into your face, that the shoulder is always down, like this. So, there are many options. As long as you have no weight bearing on it, as long as you feel that you really can relax by this position. So after 30 seconds, again, you deep inhale, you exhale, you concentrate on this area where you feel the stretch and try to reduce this stretch. And if this works, then you go further, then you know you're right. If it does not relax, you have two options. Either you just stay and wait another half a minute and maybe it works then, or you go back a little bit out of this stretch to reduce the stretch, that otherwise you might have too much draw in the muscle, and the muscle does not give you the way you need to stretch the fibers in the muscle, and then the muscle starts fighting against you, and then you will never get any improvement of the length of the fibers in the muscle when you you will not get the result you need for. That is basically it. Any other muscle we forgot?
Any other big muscle groups? So we covered.
This one not by surfing, but by using for a computer.
Yeah.
It's always the tennis elbows problem here.
Yeah.
To get this one under stretch, you think you might imagine you're a waiter.
Yeah.
And get some coins there. Okay, that's because that's the starting position. And then you look into your hand how much it is, how many dollars. You want to have them, so you grab into your hand, and then you have it into the right position. And then easily you put the arm somewhere, bring it in front of you, and then you have two options to get a greater stretch. The first option is you rotate a little bit more. The second option is you flex your hand a little more. And if you do both, you get quite a bit of stretch. Okay? And again, start gently. Do not fight. Start gently, after half a minute. Inhale, exhale, concentrate on the muscle of the stretching area. Try to relax there. If it works, you go a little bit further. Either in rotation or in flexion.
Where do you feel this?
Here.
Okay.
In this area. Where the extenders are attached here at the elbow. Okay. And the flexors, well, that is easy. Okay. Like this.
Okay.
Like this. At the wall. Okay. So, but don't do it like this way, because when you do it like this way, you have to fly to increase or to step on something.
Right.
If you do it like this, you can easily go back.
Okay.
Okay. Yeah. Some people have problems with the tibialis muscle. This is not easy to stretch. Of course, there are stretches like sitting here on the heel. A lot of people have problems in the knee, cannot do it. Others, they have unstable ankles, cannot do it. So it's not that easy to stretch this muscle. So
one of the places that I'm working on is trying to sit like kind of like this, like for paddling. So you tend to sit on your heels like that.
yeah.
So there your ankles have to be a little bit flexible in the front.
Yeah.
And
Yeah,
then
the weight bearing is not on the muscle. The weight bearing is on your bottom. It looks good. There's no option to increase the stretch. It's just the position.
Sure.
Okay. So if it's just works for you, this amount of distance from the floor, then it's okay. But you cannot increase it. If you would be even more tight than you are,
yeah.
You have the weight bearing before you have the weight bearing on the muscle before you have your bottom on the
Right.
on the sitting position. So you would need a higher distance. Okay.
So I can.
Yeah, you can.
When I go like that, there's not so much weight on the block, but eventually it loosens up, and then there's more weight.
Yeah. So there are. It's not. And you do not have the option in this way to increase the stretch a little bit by millimeters. You only have the options full, half, or
You
nothing.
can shoot what I'm trying to do. See. So like this, because when we're paddling and we're reaching forward, we obviously can't do it without the board.
Yeah.
And then like that, and it's like the weight's actually like this. You actually fall in the water and pull back, and then you sit like this. You balance on the wave, and then you have to relax. But if you can't relax here, it's impossible.
Yeah.
So at first my knees hurt a lot right in here.
Yeah.
And there was some little bit of instability.
Yeah.
But then I just practice sitting like this each day, and then it gets better.
Yeah. Well, there's one muscle group we did not show a stretch. It's the quad. The quadriceps.
Quadriceps.
Yeah, because this might be a bit too tight for you, because that is the one that gets under stretch in this position you have right now, and of course your ankle. Yeah.
Yep.
So, but maybe it is a bit more your quad that is too tight, that holds you away from a more relaxed position. Mm-hmm. So I show you the
Quadricep.
quad. So as I've shown you the one, there's some options. There's some options. So I'll show you the one for the psoas, right?
Yep.
For the psoas. So put it here, like on here. You simply need something that brings your foot up to get a stretch of your quad too. All right.
You could use the wall, maybe.
Yeah, if you have a trouser, you can bring your finger into the trouser.
Trouser.
Trouser. If you have long trouser on.
Oh, your pants are on.
Pants.
Okay.
Not trousers.
Pants.
Pants. Okay. Pants. Or you just grab it before you
Grab
start, and then you have it here. Okay.
Okay.
And then you simply increase it by bringing it higher. Again, keep your lumbar spine in a secure position. Get your body weight on here, and then you can easily increase the stretch by pulling a little bit more. You can use a strap and pull here.
Okay.
Yeah, you can do so. Like anything that is attached to your ankle, and you can pull it here
Sure.
a little bit. This might be easier than this. Okay. Of course, you can do that in a side leg position, like in here.
But not standing.
Well, we are talking about 5 minutes, 8 minutes. Okay, standing on one leg for 8 minutes and go a little bit further.
Yeah.
I want to see you. It's hard. I don't want to say it's impossible, but it's hard, and it's not necessarily hard.
Sure.
So doing it like this, it's better. I do not like it that much because I have the feeling I cannot relax the whole area.
Okay.
Because I have to lift it a little bit, and if I let it go, I always get into this position again. So, and if I pull more, I just pull in here. I cannot bring it to the back. If I bring it to the back, I fall over.
Yeah.
So it is definitely possible. I don't like it that much.
How about like the position I was in if I just go backwards without the block? You can go backwards all the way on your knees?
Yeah, you could, definitely you can do so.
Or is it too hard on the knees or the back?
Let's find out.
You don't use the block to do that.
No.
Just
So that was the one.
yeah. So sit like that, but then take the block out and then go backwards
You want me to do this one?
without the block.
Well, with or without doesn't
Without, it doesn't matter.
You cannot without. Oh, you cannot without. You have to sit on it.
Oh no.
So you can sit.
Just
You can sit like this.
Well, no. I put a pillow underneath my back.
Yeah. Well.
And then put my weight on the pillow.
Yeah. You know what? This position, to increase it, well, maybe I'm too fast.
Well, I put my feet outside my.
Like this. You get more rotation.
Yeah, I don't.
More rotation on your knees.
Is that good to turn your feet underneath like that? I don't turn my feet. I keep them straight. Yeah. Well, no, straight on the outside. Yeah, like that.
Like this.
Well,
look,
more, not that wide, just straight.
I can do these things, but I'm pretty sure it's not good for my knee.
Yep.
So I wouldn't recommend it.
No, but not that far out the knees.
Well,
kind of like in between, yeah.
If you want to increase it, you would. I feel a stretch to the quad in this position, because I do not feel a stretch anyway. I do not feel it at all in this position.
Right.
I would need to bring my bring it up like here. Now I feel a bit of stretch, but it's not a relaxing position.
Sure.
You can do so helping yourself on a thing, but if you try this position like this, so bring it here and simply do this, you feel it right away, you can relax, you can even read something.
Sure.
It's so easy. So why do it more complicated?
Right.
It's just a problem if this knee, for example, hurts.
Right, because
position.
it's quite
Then you would need something that is higher than that to bring your knee up like this. Okay. And then it still works. Okay. It's not that comfortable as it was before, but it is possible, and you have a more upstanding position of your knee and of the tibia. Okay.
But the first position is probably good for me because it stretches the ankle a little bit too on this side.
Yeah. So leaning on something, get you a rest, a good stable position of your body weight away from the area where you want to get the stretch. It's always a good thing. And then you feel, then you can concentrate on this area of the muscle you want to stretch and of this relaxation after exhaling. Inhaling, exhaling, concentrate on that area, and nothing else to do than concentration of this muscle. And then try to relax it. And if you relax it, you go a little bit further. You stay. And always keep in mind there are 5 up to 8 minutes for a muscle. One muscle.
One side.
To get one side. To get any process. But it's better to do this muscle once a week, but with an effect.
Sure.
And 10 times a week without any effect. It's always the same.
So 5 minutes minimum for one side.
Yeah.
For one exercise.
Yeah.
What do you think about the theory before, which people used to do, the AI stretching, where they would kind of bounce back and forth? You know,
so dynamic stretching?
Yeah, dynamic stretching.
Well, we tried a lot of these things in dynamic stretches.
Yeah.
But the problem is everybody is different of his range of motion, and it is not to secure in a chain. So when you do anything dynamic, it means you have a starting position and you have an end position. But these dynamic stretches, they usually look like going there and going back. But to control that is only that one joint with this muscle attached that is moving in the dynamic movements. It's almost not possible. Mm-hmm. So what I want to say, when your capsule of the shoulder ends here, any further position does not go into your shoulder. It will do a rotation of your breast spine area.
Okay.
And nobody knows that before, and nobody controls it before. Nobody does a physical examination before. Okay, so they just do it, and they do how good they can, and it is not possible to secure the next coming joint in this chain of movement, and to secure this joint from getting into the same stretch. And if this joint has a problem, then you increase the problem without getting any process in your muscle you want to get a stretch. So you can do that, but it has a higher, from my point of view, a much higher risk without any need. That's key. Without any need, because why doing it dynamic when it is much more risky than doing it static? I don't want to say dynamic does not work, but the risk is higher. So why do it? Basically, okay. Yeah. So we have very good success with these kind of stretches. The most critical thing by these strategies, but by all strategies of stretching, is with our athletes, to convince them, doing it frequently, doing it in the right time, amount of time, that it works. So yeah, but they believe us when we talk about that. But doing it, there's always other things on the daily time table that are
More exciting?
more exciting, definitely more exciting. But I've seen so many world-class athletes. The guy who won the Ironman last year, Pete Jacobs, he was in our team before, and so I had the chance to check this guy, and he was just loose in all joints he needs for his sport. So there was no reduction of any kind of range of motion, not in the ankle, not in the shoulder, not in the hip. He was just free of all of this. And I've seen some athletes with this freedom of ranges of motions in their sport-specific needed joints. But most athletes I've seen, they are much less movable. They're massive reduced, sometimes massive reduced in range of motion. When I started working with the US biathlon guys, it was from 2006 to 2009, there was a disaster. They were so unmovable, they were so stiff, these guys. So we had to work on these things a lot of time, and then this ended up that some guys they had to completely change their training, their daily training program, just because they had such a great need of stretching. So when we started with that, none of them were under the top 10 in the results. And when we ended with that 3 years later, one of the guys had the yellow shirt for 3 or 4 weeks, so being the best in the whole world competition for 3 weeks. It was a great change. Well, a lot of things they changed in that time, but being so stiff, it's not possible to give the best amount of access amount of what do you say of power of all your options you need to use to do your sport, right?
So what's a good target amount of time for someone to put into this?
3 months at minimum. You need to get into a position where you feel right away you get into a better starting position than you had before. You know a starting position, okay? Starting position by the triceps for me is like here, okay? So when I do this frequently, after 3 months, I should recognize that I can start with the stretching like here and feeling the same stretch.
Now, so 3 months of time doing it, how many days a week and how much time like per session?
It depends. If you have only one muscle group that you have to concentrate on, you can do it 3 times a week and you will get a greater, faster success. If you have 12 muscles, okay, where you recognize, oh, they are all pretty tight, they're all pretty stiff.
Yep.
You need either more time in a week or you need a longer period you're looking for.
So what's
it's hard to say.
You say just even once a week. What's the minimum number of times per week you would recommend per
muscle? If you
muscle?
have a stiff muscle system, you need at least twice a week a very intensive stretch. Twice a week at minimum. I would recommend to do it 3 times.
Okay. And not on the days you train very hard.
Yes.
Try to do it the days you don't train very hard, or maybe a day you might train lightly and then do it in the evening afterwards.
Right. Exactly. So doing Well, surfing is not that that much exercising for all the hip and leg muscles. Not that much. Not that much like swimming.
Right.
If you're fighting against a high surf, you have to swim a lot and you have to be powerful, so you're fighting. So it's quite an exercise.
Mm-hmm.
And you do not have that with your legs. So
Sure.
when surfing is the main sport you do, you can do the legs almost every day, or you could do it on every day. But with your arms, I would choose a day where the conditions are lighter. You were sitting more time, and you do not have to fight a lot. Yeah, and where you do not go with the stand up, because in the stand
Sure.
up paddle you're paddling all the time, right?
Sure.
So I would choose those days. No paddling and more relaxing surf.
Okay.
Less fight.
Maybe you take a look at me trying a couple,
Sure.
and maybe you can tell me like where should I start?
From the bottom, I think.
Okay. See, what should I do?
Start with the soleus.
So, which leg forward?
Doesn't matter.
You
Whatever.
tell me.
So go to the stretch on the left soleus.
So left soleus is right here.
No, soleus. This one. This one. So
Okay.
that was the first one I've
So
shown
the
you.
calf muscle.
Yeah, calf muscle. The short calf muscle is the soleus.
Like
Yes.
or on this knee. Or on this knee.
Now you stretch you can stretch
Okay.
your right. Now you can stretch your left.
Okay, so stretch this.
Yes. So bring your left knee more in front. The right knee more in front. Yeah. Sit on your heel. Can you do that?
That's pretty tough, but not too bad.
Okay.
But I can do it, but it's takes a little bit of balance.
Okay. So bring your
Like this?
yeah, and now bring your right knee more forward. Yes. Okay. Yeah. Keep sure your left foot is in a position to the front, facing to the front, not turning outside.
Okay.
Okay.
So-
Yeah. And now you go as forward as much as possible, that your heel will still stay on the floor.
This heel.
Yes.
So right now, I feel like the main stretch is right here. Just
Okay.
Because I'm balancing.
Okay.
And,
So
and also
bring
my abdominals are
yeah.
balancing.
So bring your weight,
Yeah.
your upper body more in front,
So I'm balancing on my knee.
and bring your arms like this.
Okay.
Yeah.
So bring this forward a little bit.
Well, depends.
Or I can bring it as far forward as to keep the heel.
No, actually, you need to bring it backwards.
Backwards to keep
Yes.
the heel. Oh, okay.
Yeah. You need to bring it backwards.
So I can just keep the heel just about like right there.
Okay.
So
Yeah.
this is comfortable.
This is comfortable. So still bring more weight of your body over your arms. Bring it to your arms
Okay, like
to reduce the weight bearing necessity of your left. The left one is the one you wanna stretch.
So the left one, I want the weight bearing on my left heel.
No, you want to have the weight bearing on the opposite side, on the right side.
side right
Yes,
here.
and on the arms.
Okay.
A little bit on your left foot. That's not a big
Okay.
deal.
So I don't feel much of a stretch.
Yeah,
on the left
weight.
foot.
Weight.
So this one is more subtle. It's not like your hamstring or your quadricep.
Yeah. So if you do not feel a stretch, even not after a longer time, that might be a sign, or this is a sign that your capsule does not allow a further movement, that you start getting a stretch, feeling the muscle. Then the capsule holds you back from going any further.
Should I have a little pressure on the ball of my foot to stretch out the back of the calf?
You can, yes, you can, as long as the heel stays attached to the floor. So bring your right knee a little bit more into the front.
This
Yes, a little more to me, a little bit more, just a little bit more. That was a
Right there?
bit too much, okay? So, yeah, and stay.
Okay.
And bring your weight a little bit more into the front.
Okay.
Okay. Yeah, looks good.
And then focus on the heel.
Focus on the
Keeping
heel,
down.
needs to stay down. on the floor.
So the place where this feels quite hard is on my right ankle.
On the
I'm stretching out the foot.
Yeah.
So that's okay to stretch other parts as you do this?
It's not ideal. So lift up your bottom a little bit and bring this between. Okay.
Well, that's much easier.
Okay. Yeah. It's allowed. Don't stretch other things. That keeps you away from timing.
Right.
Okay. From staying a longer time, or from any other stretch.
So this one, how would I know if this one has the proper mobility or not? Like, does this one look tight to you?
Yeah.
This right here?
It looks very tight to me.
Well, probably everyone is going to be that way. Okay.
So the test is, please get up just for a second.
Okay.
Yeah. And get into this position.
Okay. So right here, it's quite sore.
Yeah.
Okay. So sit like that.
Yeah.
With the feet slightly up.
Just in front. Bring them in front.
Okay.
Okay. So.
I'm about to fall backwards, but.
Yeah. So and then you bring both arms to the back side.
Well, that's not so easy.
Yeah, and still stay down. That's what I mean.
Okay, so when you could do that, then you're.
Yeah. You can do that just by bringing a bit of your body weight with your arms in front, okay? But the position of your ankles do not allow
forward
a greater angle in your ankle joints.
Like right here.
Yes. And soon you can do so. You would not need any more stretch.
Mm-hmm.
So now you cannot.
Okay.
So it's a good thing to increase it.
And that's the with this position here, it's a lot easier to adjust this foot than this leg. To move this foot forward and back. But you were having me adjust this leg.
It doesn't matter. Okay. If you bring your left heel backwards or your right knee forward, that's the same thing.
So just by doing that very gently over a long period of time, this angle will get better.
Yes, it gives you a greater amount of extension.
Okay.
This is the extension.
Okay.
This is the flexion.
Okay.
Okay. Extension, flexion.
So this one.
And again, you can read something. You can call somebody and talk to him in doing it. You know, you don't have to sit. You don't have to stand.
Sure.
You just go down in this kind of stretch. If you're used to these positions, there are so many times during a day where you could do it
for a little bit.
For a little bit.
And so probably also the more you do it, it becomes much more comfortable.
Of course.
And then keep on eventually without turning the foot out.
Yeah, right.
Because then it's counterproductive. Is it okay if the foot turns just slightly out?
Yeah, it's okay.
Like this is about right?
Yeah.
Otherwise it doesn't feel quite. This side's a little looser right here.
Yeah.
So just like this.
So if you feel it looser on the left side, I would concentrate on the quad on the right side.
Concentrate on the what?
Quadriceps.
Quadriceps on the right side.
Yeah, to loosen this one up.
Sure.
Okay.
Sure.
So I would not start with both sides. I would start with the right side until in this stretch for the soleus muscle, you feel the same tension on both sides.
So
would be a mark, you know. Would be just
so you would start
a test.
like I start like this until it's the same tension.
You said in this position when you want to stretch your left calf, you feel more tension in your right quadriceps.
The right ankle more.
In the right ankle.
Yeah, right here in the ankle.
Not the quadriceps.
Maybe a little bit. Too.
Oh, okay.
So both. Just this whole side's a little bit tighter.
Yeah. So just okay.
I thought. Start off with the tighter side.
Yes.
And give that side a little more time until they even out.
Sure.
Okay.
Sure. Don't work. Concentrate
on those you're good in.
Sure.
Concentrate on those you're not good in.
And what would be the next one you want to see me try?
I think the psoas is about the same. Let's go over the hamstring. I'm pretty sure you're pretty tight in that.
Sure. So which way should I do that?
Against the wall here.
Okay. With the pad?
Yeah, we take the pillow.
Now, how important is it to carry around the little pillow for the back?
I think for you it's very important. You had the disc hernia already, right?
Oh yeah.
Yeah. So that's the answer.
Only 2 major injuries.
That's the answer actually. So I give you
Like
another thing that's nice. Great. Yeah, this looks good. And make sure your right leg is down. Okay.
My heel is on the ground, but my knee is
Yes.
off the ground.
Should be on the ground as well.
So
Now it
extend
is. Now it is.
Extend out my heel like this.
Yeah.
So now I feel a stretch here.
Yeah. You feel a stretch on the hamstring there.
Both.
Good.
Probably more right here than the
Yeah.
hamstring.
So that's what I say. You're quite tight in your quadriceps.
Right.
So you have to work a lot in your quadriceps.
Okay.
Okay. So you can help yourself with the left arm to straighten the knee. Yeah. Just bring it not on the kneecap, just a little bit above,
Yep.
like in here to straighten it. Okay.
Okay.
And if you're fine with that, just move a little bit further.
I can't
You do not-
really go any further. 'Cause my
You
buttock
you can just move.
is- My buttock.
You pass
off the wall?
just pass it.
Just past the wall.
Yeah,
Like
just
this.
pass with the whole body. Go a little bit more, coming to me.
Come
Yeah,
here. Okay, like
yeah,
that.
even a little bit more. Yeah,
Okay.
and then you can pass. Go further.
Okay.
Okay, so you're not that tight than I thought you are. So this is not a muscle group you're really
Maybe
shortened.
Too much time on this. It's more of this.
Yeah.
Right here is where I feel it. This right here.
So this one you can forget for the next month. Okay.
Focus on the
Do
other.
not focus on that.
Okay.
Focus on the quad.
Okay. So which should I try for the quad?
So yeah, let's go over the quad. I mean, you have this nice thing here.
Well, the quad and the hips.
Yeah.
The quad and the
But being loose in the hamstring is very, very good. A lot of people are very tight and they have so much trouble to get it better.
Okay.
So please show me the stretch of the right quad.
the right quad. Well, you have to tell me again.
Yeah. You can use this. You like this here, and then
Oh,
this
that
one
one.
up.
Okay.
Okay.
So I think you did a couple different ones.
Yeah.
So you think with this is better?
Yeah.
Okay. So this one will be like my left. Let's see, my left knee right here, like this.
Yeah. But then you need to bring the pillow on the other side.
And like
Yes. Okay. And then you almost lean on. Yeah. No. With the other side. Just lean on it. Just come
Okay.
come down.
there. Oh, so don't even grab. The
Yes. That you relax on the pillow.
foot. Okay. Now how about this leg?
That doesn't matter if it doesn't hurt. So now you need to grab with your right arm your right ankle. Yeah, and come back in the same position. Relax. Yeah. Hang on a second. Go up again. Bring it a little bit more like this.
Oh, okay. Like
That you
this.
can be aligned.
Oh, perfect.
Okay. Okay. So and you can roll it a little bit more into the front. You get a greater stretch.
Sure.
Okay.
And also the harder I pull.
Yeah. Well, even better would be if you grab not your foot, if you grab it just above your ankle joint. So, yeah,
Lower.
even more there. Otherwise, you
Stretch
you
the
can stretch your ligaments of the foot, which is not that nice. So, yeah, this would be the right
Minutes
position.
of this. Now, is this one sufficient, just this one for the quadricep?
That
Or
is
should I do-
the most effective position to stretch your quad. You should feel it already.
Oh yeah, definitely.
Yeah.
And then switch to like this. So just like that?
Yeah. And if you see your video later on, you see that your hip on the right, on the left side,
Yeah.
is even on the left side, and the right was worse. Is not really extended.
Okay. Oh, I see. You want it like this.
Yeah.
Okay. So I should, right.
Yeah, but now you do something which produces another problem.
Well,
You
now I feel it right here.
Yeah, and you give more weight bearing again to this leg. So better it is you bring the pillow a little bit more in front.
Bring my foot a little more front.
Yeah, exactly,
And then I could put more weight on the pillow.
exactly. Yeah.
What does it mean if I feel tightness here?
Well, then you need more stretch of the gluteal area.
Sure. That's a big problem.
But it's a combination stretching, because you have a lot of weight. Now you have a lot of your upper body weight on the pillow.
Yeah.
You should have.
Yeah.
So would be a good stretch for your gluteal area too. It's not specific for one muscle of all those three, but it's a good position.
Right?
And again, when you move even a little bit more forward, yes, exactly, yeah, you get a greater stretch.
Okay.
But still, bring the pelvis down there.
Mm-hmm.
Okay.
I mean, this is a good stretch even with the foot down.
Yeah. but more for the psoas now.
More for the psoas now.
Yeah, it's not that much for the quad.
No.
But in both, it's one chain, right? So in both muscles, you're pretty tight.
So this is a good one for the psoas too.
For both, I would start with that one, and then I can continue
Then go on to the quadricep.
to the quad. Yeah, same position. 16 minutes, 15 minutes.
This one feels great on that side.
Yeah, and do not start with too much stretch.
Right.
Yeah.
And then plus I feel it right in here.
Yeah.
Not the hamstring, but
Keep a lot of weight on the pillow. That's the goal. That this works for what you want. You need to bring your body weight on the pillow.
okay, so the body can relax.
Yeah.
Okay, what's next?
What else do we need?
You tell me. The hip flexibility. I think the ball is the place where it's.
Yeah. The one in the wall is easy, but the one on the floor you should show me.
I can do the one on the floor. This one I practiced before. So like this.
Yeah.
Like this. Grab here. Grab here.
Yeah. Again, you feel that your bottom lifts up.
Yeah.
You get a stretch to your ligaments up
Yeah.
there,
So
which is
keep
not
the
good.
bottom-
So better get up.
Yeah.
Get up and do it in this position. The other side is going away.
Okay. You have to tell me how do you do this one?
Yeah,
This one
I show you. I show you. So it is 90-degree angle of your knee, and this one goes the opposite side.
Okay, so that was right. I remember this one now. And then there's the three positions. Right.
Bring this one.
Like that?
No, bring this one more to the side first.
Like this.
Yeah, open the angle to reduce the stretch of your meniscus.
So right there? So
Yes, exactly.
Okay. And then this one wherever is comfortable?
Exactly.
Like this?
So first is you need to rotate with your pelvis.
Right, so just this is a stretch right here.
Yeah, I believe you, because you're tight in the adductors.
Right?
Okay, so but this doesn't matter.
Okay.
Try to
Lean forward just a little bit.
just a little bit.
So this one here, I wonder if it's hard to get the stretch here because of the tightness here, but it's very subtle. I feel it just a little bit.
Okay, so start with that.
Just like there, but possibly you can, like, I think you were telling me you can extend up like this.
Yes.
Extend, and then I could feel it more. So it's more, as opposed to the back rounding.
Yeah.
More.
Exactly.
Like
just
this.
a little bit.
Right, just a little bit, and then you feel it a lot.
Yeah.
And then to go to then this
This
side.
way. You do not need to bend that much. Just first rotate your pelvis a little bit more.
I don't move the feet.
No.
Okay.
Just the pelvis.
Like this.
Yeah, and then bring it a little bit more forward.
Just like that.
Like that. You feel it right away.
Oh yeah.
Yeah.
Plenty. Especially, so each one of these hold for 8 minutes.
Well, again,
3 minutes.
30 seconds. Inhale, exhale, try to relax. And then you start in a gentle position, then you go forward during time. It's not holding it for 8 minutes.
Right.
It's working on it a little bit,
But does 8 minutes count
a little
each
bit.
position, or 8 minutes?
No,
the total?
for each muscle.
So 1, 2,
So
3.
I would not go for 8 minutes.